Hey, Doc audience. We get a lot of different inquiries about things. And so, one of the things that has come up is anesthesia for surgery. And some people are scared of going under, and that's called general anesthesia. But there's some important points that render some discussion. So, let's talk about that. The first surgical procedure that was ever done, they used ether actually for the anesthetic, because ether was, it was old, totally old school. Certainly not the first choice now. It's not even used now, but things that have obviously advanced an incredible amount. The two biggest things people are scared of from surgery are number one, pain and scarring. So let's just remember that, and then we'll come back to this. So there's three different types of anesthesia primarily. So there's local anesthesia, which is basically we're using local anesthetics to inject, say, the area where you're treating. So if you have a mole, you're going to take that mole off. You can inject the skin, and it numbs the skin. Now, the patient can still feel things moving around, and they're totally conscious, but they don't feel things that are sharp. So they kind of feel things move around, but it doesn't hurt because it's anesthetizing the nerves that go to that area. And then on the other side of the spectrum, we have general anesthesia. And now general anesthesia has advanced so much that that's really any major surgery is done under general anesthesia. And that's usually or typically where the patient is put to sleep using there's many different agents now, but they're all tend to be very good. And the patient sometimes breathes on their own, sometimes they don't breathe on their own, but they're cared for by anesthesiologists, or in some cases, a certified registered nurse anesthetist, which is called the CRNA, which has become more and more common in this day and age. General anesthesia is the weirdest thing, right? And you're put to sleep, and the next thing you know, you wake up, and it might have been 4 hours later, but you just have no sense for any of that time. So you're just out. So the misnomer is that, say, local anesthesia, or there's a third. The third is the in between. So it's sedation. But the problem is that what happens is people who, for example, and then we see this a lot in plastic surgery, people who can't get hospital privileges to do a procedure where they could do it, say, under general anesthesia. They can't go to a surgery center, an accredited surgery center, and get privileges. They come up with some sort of concocted story that, local anesthesia is so much better. We've seen this time and time again. Perfect example of this is awake breast augmentation. And so there's doctors that are out there. For example, OBGYNs are notorious about this. I'm nothing against OBGYNs, so I'm not trying to start an argument with anyone. Actually, I love OBGYNs, and they're fantastic when they're doing what they're trained to do. But they can't get privileges in the hospital to do breast augmentation. Now, they get privileges to do cesarean sections, other procedures that they normally do, that they do in their specialty, but because they're not trained to do breast augmentation, they can't get privileges for that, or at a surgery center. And so, and this is, again, it's always the one end of the spectrum that drives the conversation. So these are people that are few and far between. So the majority of OBGYNs, and I'm using this as an example, so I know we're going to get a bunch of hate mail that I didn't even pick this especially, but it's just an example. So there's like a very small handful of OBGYNs have decided to market this thing called awake breast augmentation. The real reason they're doing it is because they can't get privileges in the hospital to do it the normal way, the way that, say, I do it, or a board-certified plastic surgeon would do it. What they say is like, women want to change their size, and it's way better to do it under local in the office, because then you can decide on your size. And that's actually probably a whole nother hey doc that we should talk about. But the point is The real reason is that they can't get privileges to do it in the hospital. The said reason or the argued reason is that, oh, it's so much better, which, for the past 25 years, I've been working on optimizing outcomes in breast augmentation and published all these papers. We know 100%, beyond a shadow of a doubt, that awake breast augmentation in office is not better than the way it's done, say, under general anesthesia. That's the typical way that my preference is to do it. But you can do, a board-certified plastic surgeon can do your breast augmentation in their accredited surgery center, and some of them do use local anesthesia. I would say probably no really high-level, high expertise breast augmentation surgeons do straight local breast augmentation. Because what they do is they do sedation. So there's some sedation involved and local anesthetics. My preference wouldn't be not to do it that way, just because there's certain things I think, and certain safety things that I really want to have for my patients. But it's a perfectly legitimate way. The only thing that is a little bit dicey is that when you do sedation, what happens is if the patient's not comfortable, you give a little more sedation and a little more sedation. And at some point, it's called when the patient goes into level 3 of a general anesthetic, where basically they can't control their airway. And so that can be a dangerous situation. So the thing about it is with general anesthesia, and gets to the whole thing where people are worried about, I'm really worried about being put to sleep. The truth is that general anesthesia is the safest out of all the things, because sedation is also, it can be, when it goes well, it's great. But like I was saying, if you kind of roll over into that point where you can't control your airway, it can be a very dangerous situation. So remember, back to where I started, the two biggest concerns of patients are scarring and pain. So this is the part, my patients, we do it under a general anesthetic delivered by an anesthesiologist, a board-certified anesthesiologist. Our patients, it's a 20-minute procedure, 20 to 30-minute procedure. Our patients come in the surgery center, they have their procedure. They're 100% comfortable all the time. There's no pain at all. In fact, when they wake up, they're like, oh my God, did we do it already? And then they go home and they're on their fast track 24-hour recovery routine. They're out shopping the day of surgery. They're out to dinner that night. They pick up their children under 3 right away. It's just an easy, fun experience. And they don't worry about pain. So if you do it the other way, if you're going to do it, let's say with local anesthetic, like say, most people are not doing just straight local for that procedure, say breast augmentation. They're going to do local and sedation. That may be 100% fine, but it also may be where you actually feel something, or, you have some recollection of having pain. So that's the part that's a little bit clouded for patients. So it's the same thing. I would say, most people, before they started driving a car, were scared of driving the car. They were petrified of it, right? They haven't done it before. But after they become experienced driving a car, they're not worried about driving a car anymore. So you the more you know about something, the better you're going to do. So I think that it's just important to know that this notion that, local anesthesia is so much better, it's just not true. And then I would argue that there are certain things that you can do some sedation in local, and I think it works very well. But to substitute local with sedation for everything is just not going to work well. I can tell you, it would make totally sense to people. If you're going to have open heart surgery, it could be done under sedation and local, but nobody would do that, and no patient would ever think that's a good thing. But what happens is when we get into kind of the cosmetic surgery realm, sometimes there's all this kind of marketing that gets pushed along as the science or the word of God, and it's just not right and not accurate. So what I would say is that you need to pick the right anesthesia for whatever procedure you're going to do. I would be very careful of procedures that typically are done under general anesthesia that somehow are being touted as, this is going to be so much better under local. I think that's a misnomer, and I think that it may end up resulting in more pain for the patient. The other thing about scarring, we didn't even talk about that, but if the patient's moving around, sometimes the surgeon can't even do their job like they normally do because the patient's not comfortable, they're moving, it's creating a lot of stress in the operating room environment. So again, if you're gonna have surgery, you want to be comfortable, you want to have no pain, you want it to be the absolute safest you can be, and you want your surgeon to be able to do their procedure at their highest level of expertise. And I would submit to you, after all that's said and done, that for major surgery procedures, that a properly done general anesthetic is much safer and much better for the patient for those reasons we've talked about. So I hope that clears up some of the confusion that's out there on anesthesia, and we'll tackle another problem that you all submit to us. So keep them coming. We're going to, anything you want to hear about, we'll talk about it here on Hey Doc.